When I was 13 and visiting Liberia, I contracted what turned out to be yellow fever. I met with the local doctor, but he couldn't make a diagnosis simply because he didn't have access to blood tests and because symptoms such as my skin feels like it's on fire matched many tropical diseases. Luckily, my family managed to drive me several hours away to an urban hospital where I was treated. Yellow fever shouldn't be fatal, but in Africa it often is. I couldn't believe that such a solvable issue could be so severe at the time, so I began to explore. The exploration led me to the African Disease Prevention Project, ADPP, a non-profit organization associated with several universities. I decided to create the first high school branch of the organization. I liked its unique way of approaching health and social issues. Rather than just raising money and channeling it through third parties, each branch adopts one village and travels there to provide for its basic needs. As branch president, I organized events from small stands at public gatherings to 60-person dinner fundraisers in order to raise both money and awareness. I've learned how to encourage my peers to meet deadlines, to work around 30 different schedules at once, and convincing people why my organization is worth their donation. But overall, ADPP has taught me that small changes can have immense impacts. My branch has helped raise almost $3,000 to build water sanitization plants, construct medical clinics, and develop health education programs in the small village of Zudru. And the effect doesn't stop there. By improving one area, our efforts permeate into neighboring villages as they mimic the lifestyle changes that they observe nearby. Simple things like making soap available can have a big effect. The difference between ADPP and most other organizations is its emphasis on the basics and making changes that last. Working toward those changes to solve real-life problems is what excites me. I found that the simple idea of change through simple solutions also rang true during my recent summer internship at Dr. Martin Warner's lab at UCLA. Dr. Martin's vision involves using already available digital technologies to improve the individualization of healthcare. By using a person's genome to tailor a treatment for them, or using someone's personal smartphone as a mobile monitor to remotely diagnose symptoms, everyday technology is harnessed to make significant strides forward. At the lab, I focus on parsing through medical databases and writing programs that analyze cancers' genomes to find relationships between certain cancers and drugs. My analysis have resulted in a database of information that physicians can use to prescribe treatments for their patients' unique cancer's mutations. Now, a pancreatic cancer patient does not need to be a guinea pig for a prototype drug to have a shot at survival. A doctor can choose the best treatment by examining the patient individually instead of relying on population-wide trends. For the first time in my science career, my passion was going to have an immediate effect on other people, and to me that was enthralling. Dr. Martin's lab in his book Digital Healthcare, A New Age of Medicine, has shown me that changing something as simple as how we treat a disease can have a huge impact. I have found that the search for the holy grail of a cure for cancer is problematic, as nobody knows where exactly what it is or where to look, but we can still move forward without it. Working with Project ADPP and participating in medical research have taught me a way to approach problems in a new way. Whether it's a complex genetic disease or a tropical fever, I found that taking small steps often is the best approach. Finding those steps and achieving them is what gets me excited and hungry to explore new solutions in the future.